All right, good afternoon, everyone. I think we'll get started. So welcome to Harvard Law School. I'm Caitlin McCormick-Bro. I'm the Associate Director here at the Center for Health Law and Policy Innovation of Harvard Law School. And thank you for joining us today for Health in the Headlines, both those of you in person and online. The past year and a half has been a wild ride for pretty much everyone, but particularly in health policy. Last January, poised for his inauguration, Trump proclaimed that the first thing that he would do upon taking the oath of office was to repeal the long derided Obamacare. Republicans in Congress were eagerly awaiting an opportunity to fulfill his wish, and Tom Price stood at the ready to dismantle the rest of the ACA's framework. And despite all of this, here we are. And where we are is that there have been repeated attempts to repeal the Affordable Care Act that have failed in Congress in spectacular, dramatic fashion. And even just yesterday, we found out that even by CMS's own counts, 12 million people this year signed up for insurance through the Obamacare marketplaces. And this was even despite the administration's large efforts to undermine open enrollment, cutting the enrollment period in half, eliminating navigators, and much more. So there have certainly been much said and many different factors that have contributed to this remarkable chain of events, notably the strength of the chronic illness and disability and Medicaid advocacy communities. But I think one of the factors that has strengthened all of the rest has been the incredible professionalism of the many reporters working on health policy. It was their tireless pursuit of truth about what was being proposed and the impact that it would have on real lives, even if it required camping out in the bowels of the Senate until 2 a.m. It was their light-speed analysis of complex regulations on short notice, translating the real intended consequences behind the talking points, and it was their tenacious investigations that brought down a cabinet secretary for taking luxury travel while dismantling health coverage for low-income populations. So I'm delighted to introduce the women on our panel today. First, we have Julie Rovner. She's the Chief Washington Correspondent at Kaiser Health News. She spent 16 years at NPR covering health and the Affordable Care Act from when it initially got started way back in the day. Can we say that now? Yeah. Next is Margot Sanger-Katz. She's a correspondent at the New York Times, where she covers healthcare for the Upshot. In addition to covering the Washington beat, she also writes about emerging research and produces a wealth of analysis that often debunks political talking points. Rakana Pradha is a healthcare reporter for Politico, where she covers the Affordable Care Act's implications for federal and state health policy. She was also part of the crack team that brought down Secretary Price, uncovering his luxury travel habits. And finally, we have Emma Sando, who will be our moderator today, noted Medicaid enthusiast and PhD candidate here at Harvard, the Health Policy PhD program. She's also a veteran of the Obama-era Centers for Medicare and Medicaid Services. So thank you all for being here today. And finally, just before we get started, one more thank you to all of our sponsors that have worked with us on this event, the Petrie Flom Center here at Harvard Law, the Shorenstein Center at the Harvard Kennedy School, the Harvard PhD program in health policy, and of course our incredible co-sponsoring student groups, the Harvard Health Law Society and the Harvard Chan Student Association from the Harvard Chan School of Public Health. It has really been a delight to work with all of you on this crossover, cross-Harvard project, and we really hope that we can continue to find ways to collaborate in the future. And finally, we are live streaming and live tweeting today, so please do feel free to tag us, post. We are at Harvard Chilpy using hashtag Health in the Headlines, and our fantastic panelists, their handles are here as well, so please feel free to engage. Thank you all so much for coming.
And I want to echo Caitlin's excitement about this panel. I'm so lucky that we have such impressive people here. What's going to happen is I have a few questions prepared, and I'm going to ask the group these questions, and then we will have time for questions at the end. I want to emphasize that they are questions, not comments. So the rule is that all of your questions should end with a question mark, and should be as concise as you possibly can make it. I'll remind you of that again when we do go to questions, but starting out here. So this has certainly been a very exciting year for all of us. And looking back on the year, what has surprised you, and what are some of the things that you really remember the most, and some of the stories that you are proud of?
So this is like very selfishly focused, but one of the big surprises to me is actually how interested the public has been in relatively arcane details about health policy, which is sort of, I don't know, hang on, sorry. Is that better? So one of the things that has really interested me is the degree to which the public really was interested in the nuts and bolts of these policies, what the changes would have meant, how they would have worked together. It was just like extraordinary to see this incredible interest in health policy, because I think that sometimes we feel like we're just writing for you guys, for a group of nerds who are also really interested in what we're doing. And it was, I think, really heartening that when the stakes got high, that the public was also really engaged, and they were interested in not just the talking points, but also what they meant, what lay beneath them. So that kind of invigorates me to keep going.
I think the biggest surprise to me, and you just heard it, that there are 11.8 million people who are still buying insurance on the exchanges, when all of these things that we had all written, if the CSRs go away, it will implode. If the individual mandate goes away, it will implode. All these things that we thought the Affordable Care Act could not withstand, it actually withstood. So I'm getting out of the prediction business entirely now.
Yeah, so I got out of the prediction business, I think, in 2016, as did most of my colleagues, for obvious reasons. So I actually want to piggyback on what Margot said. I think it's, the ACA is an incredibly complex piece of legislation, and for years and years and years, I, and I'm sure others, felt that people really didn't understand it, what it meant. But when it was on the chopping block, so to speak, you saw these defenses of some of it, even the unpopular pieces from, quote, real people that were just extraordinary, like explaining it in a way, and you thought, where were these people 5 years ago? And I guess maybe, again, when the stakes are really high, people...
Or where were they on Election Day?
Well, that's another question. But I think there was one instance where I saw a video, I think it was of a town hall meeting in Tennessee, where someone basically said that repealing the individual mandate was anti-Christian. And she said this to her representative at the time, and had this very poignant, explanation. And I said, this is amazing. Who would have thought that this would have existed? So I think, that goes to show that people do really pay attention, which is heartening for us as reporters. So.
Great.
It's nice to be relevant.
So as the debate has moved from the congressional world to the administration, as the administration is putting out new guidance, as well as many states taking up additional flexibility, how does that change your job, and what sort of things are you looking for as we're moving into a different world today?
Okay, I'll take this one without giving away my story ideas. But so I think it's always interesting, I think, in Washington when you have a transition in power between administrations for a lot of different reasons. New people come in. It's especially interesting when you have people of the opposite political party coming in and running the government. So I think in this case, yes, the ACA is still law, but obviously there's a considerable amount that the Trump administration can do to make it look, different around the edges. So I think they're also trying to decentralize things so that state governments have a lot more leeway. I focus on states, so I'm biased. It's my favorite beat. And so I think there's just a lot of nuance, and it's always really interesting to see how people sort of push the envelope, and there's a lot of that going on, and I'm sure we'll talk about. Emma's favorite subject, obviously, Medicaid, so we'll get into that later. So.
Okay, let me see if I get the microphone right. So I came to Washington just after the Affordable Care Act passed, and so I sort of missed the last big congressional effort on healthcare, and arrived in Washington at this time when the Obama administration had to figure out how do we take this giant new piece of legislation and actually make it into a workable thing? And it just became clear to me very quickly how much of government actually happens after legislation passes, how little covered it is relative to what Congress does. So, the passage of the Affordable Care Act, the efforts to repeal the Affordable Care Act recently are like on the front page of the newspaper every day. Every political reporter cares about them. Every congressional reporter cares about them. But actually, and we're learning this now because we're seeing how the Trump administration is taking the same law and making extremely different choices. And, some of them will be challenged in court and perhaps will not prevail. But I think a lot of them are possible under the existing law. I feel like it's really powerful to see how much regulation actually shapes our world and how much law really is happening in the regulatory process and not the congressional process. So I feel like because I came to Washington in that moment of regulation, I have always had this attitude of being more focused on what can the agencies do, what are the effects of this, how do they make their decisions. And so this is a really interesting moment because the Trump administration is obviously averse to most of the major goals of the Affordable Care Act. They don't like it. They've been very clear that they want to repeal it. But because Congress couldn't muster the votes to hand them that, they're trying to figure out how they can redirect the existing law to accomplish their goals within the kind of legal bounds that they have. And they've made a lot of really interesting and creative choices. And again, I think some of them are going to be subject to legal challenges, but I think that what we're seeing now is a very different version of the Affordable Care Act. It's sort of the Affordable Care Act with a lot of escape hatches, where people who don't want to buy the kind of insurance that Congress wanted to be the prevailing kind of insurance can now kind of escape out to the edges and find other options, one in which instead of having kind of a template for what Medicaid looks like in every state, where states are going to have increased abilities to come to CMS and bring their proposals for how they want to run their Medicaid programs. And so, I don't know, I think it is harder to get the attention of people interested in these changes, but I think that they are really important and that they have almost as much impact as the legislation itself.
Yeah, that's exactly what I wanted to say. The big challenge is getting people as interested in what's going on in the states and what's going on in the regulatory realm as they were in Capitol Hill. There are, almost literally 1 million reporters on Capitol Hill these days. It's impossible to go up there. You used to be able to go and, there would be these Tuesday afternoon lunches and there was a scrum of reporters and there would be maybe 20 or 25 reporters. You could get in a little knot of reporters with the senator and you could actually hear. And now there's like 50 reporters around every single senator. If you get in close enough to hear, you can't get out. It is a problem, and yet in these state capitals where there is so much that is equally, if not more important, happening, there'll be, if you're lucky, 2 or 3 reporters. Regulatory coverage is hard and arcane, and it's very hard to get editors interested in it, much less readers, and yet, as Margot points out, a lot of big changes happen through the regulatory process. Good example there, we spent basically last year with Congress trying to figure out how it was going to defund Planned Parenthood until it finally reached the conclusion that I had written about months before. It says if you don't have 60 votes, you can't really defund Planned Parenthood because you have to change Medicaid law. Well, it turns out that there's some clever people going into some of the regulations and no, they can't say, Planned Parenthood, you can't have federal money, but they can certainly make it an awful lot harder through some of these regulations. So some of it is just the challenge of getting people to pay attention to the things that they were paying attention to when they were going on in the Hill that are happening in similar, though a little bit harder to understand ways now.
Just from a practical standpoint, how do you cover the members of the administration if you can't get 50 reporters crowding around them? Where do you find them? How do you contact them? What does that look like for people that aren't reporters? That whole process.
Well, I guess I can go. So it's quite difficult, which is probably not surprising. So how do we find people in the administration? I will say that as of late, the administration has gotten better about access with reporters. They've started holding sit-downs fairly regularly just to take questions on things that they want to talk about, but obviously, we don't exactly stay on message with what they necessarily want to talk, whatever the topic of the day is. But, all of us, I think we have to rely on, of course, dealing with press people inside the agencies who are not always willing to help us, to put it diplomatically. Although, Emma was wonderful when she was there, so I should say that does not apply to you. It's very difficult to get our questions answered. I'll, kind of keep it concise at that. But I think everyone here probably talks to people who work for the government, and so even if they are not publicly authorized to talk to us, I mean, that's a lot of how at least my colleagues and I figure out what's going on. But it's definitely a challenge every day. It's usually a reporter's life is, answering questions and having your emails ignored and phone calls ignored. So,
One thing I will say, taking the very long view, this is my 6th administration since I've been covering health policy, 4 Republicans and 2 Democrats. And I will say that with each succeeding administration, it has been more centralized, information access has been more centralized within sort of the press offices, particularly at HHS. It's become increasingly difficult, and it's not a partisan thing. It has become more difficult from administration to administration to administration. We reached, I think, sort of the peak of it last year when basically nobody was talking to anybody except, through back channels quietly off the record. I will say, as Rashana mentioned, that since Secretary Azar has come in, he has made a point of at least sitting down with the media in 3 of these now, in a little more than a month. Seema Verma actually had her first sit down with reporters, so there's been a little bit more. You can't keep it completely closed down for long, but this sort of trend towards trying to keep things as close to the vest as possible has been one that has increased throughout my reporting career.
So a few years ago, I did this wonderful fellowship at Columbia where I got to go to business school for a year. And at business school, they teach you a lot about networking because it's like basically a class full of people who are all trying to get jobs in business. And they're supposed to work their Rolodex, call everyone in their professional contacts. Who do you know? Take them to coffee, schmooze them, get them to connect them to the next person. And when I first heard about this, I was like, well, this seems kind of gross. And then I thought about it a little harder, and I was like, oh, they're reporting. This is what we do. So, if you think about our day-to-day job of how we find out information, some of that is through the front door, right? We just call the press office and we say, we have a question about this fact that you said, or we want an interview with the secretary because we think that his comments would be important for this article that we're writing. But a lot of what we do is we just say, oh, I know this guy who might be friends with someone who knows this thing, or I know this guy who's a lobbyist who might have seen, an early draft of the legislation, and then, I take that guy out for coffee every once in a while, and I ask him, who else do you know who could help shed light on what's happening? And, some of that is just being a nice, persistent person. I think some of that is your credibility is in your work, that you are explaining things accurately, that you're being fair to people, that you're not getting people in trouble for talking to you if they're not authorized to talk to you. But, I think the sort of metaphor of networking for me really helped me think about what reporting is. So I feel like I do less work now where I'm talking to people inside the administration trying to predict what actions they're going to take ahead of time than I have at some earlier parts of my career. But it's really important to me for the kind of writing I do, which is explaining, okay, this thing happened, what does it mean, how will it work, how does it intersect with other things? And I think it is really important to understand the motivations of the people who are implementing the policy. Why did they make the choices that they made? And, I think when you come to people with that and they have some experience with you, you sometimes can get them to share their insights.
Great. So I know a lot of people in this room have been very excited for you all to come because we read you often and don't know what your lives are like, and getting insight into what your day-to-day is like is very important. But in the broader public, the trust in the media has been going down, and the whole fake news and world of media being in the spotlight has really been changing things. What are some things that you want your readers and the general public to know about what you do and your life as a reporter?
I mean, just to kind of keep saying what I was just saying. I think the most important thing, and I think sometimes the really hard thing to communicate with people, is just that, like, we're really trying to get it right, that we're serving the public. We want them to be well informed about what's happening, which is both the facts of, these events happen, the kind of news, and then the broader context. How does this news fit in with what the systems already exist? Why are these people choosing to make this kind of news? What are the possible consequences, both practical and political? And, you just want to be seen as a fair broker, and I think a lot of that is just about doing a good job, talking to lots of people, being really fair, showing your work, being careful, not making stupid mistakes But I think it's increasingly hard because I do think that some of the attacks on the media as sort of fake news is really not anything more than just an attempt to discredit the work that we're doing. And so I do think that this is a particularly challenging era, but I just try to focus on doing the best job that I can.
Yeah, I mean, the reason I became a reporter is because I wanted to sort of and a policy reporter in particular is I have a knack for being able to understand hard things and then explain them back to people, which is harder than you think. You can tell sometimes when you're reading something if somebody's using a lot of jargon or isn't quite clear. You can tell that they really don't understand what it is that they're writing about. And so I think the most important part of it is actually understanding the topic and then figuring out how to translate it for people who want to understand it, but perhaps not at the depth to which you just committed a lot of time and brain power. And it's sort of frustrating because that's really all I want to do, to see, people now challenging sort of basic premises of what is fact or what is your motivation. I think almost every reporter I know, their motivation is to tell people things that they think are important and that people would probably like to know or should know, and to do it in a way that's understandable. And most reporters give up a lot of advocacy inclinations when they become a journalist. I grew up in a house with journalists. My mother worked at the Washington Post. We weren't allowed to put bumper stickers on the car. We weren't allowed to, to advocate for anything. That's basically, I've known this all of my life. And so because you give things up in order to be seen as an honest broker, it's frustrating when you're suddenly being challenged.
Yeah, I mean, I think, especially because the three of us work in Washington, obviously it's a really, it's not just this year or last year, it's just increasingly become polarized, especially just healthcare in general. And I would say, for me in particular, I mean, the reason why I got into, I didn't always know I wanted to do healthcare journalism, but I knew I wanted to do government public policy oriented work. And it was because the most important thing to me was to hold people who are immensely powerful in our system accountable through different ways, whether it's explaining what it is they're doing to the public or investigating cabinet secretaries, And I think what's important is that the work that we do is not all fueled based on partisan leaks. It's not just fueled based on people who are angry. It takes a lot of research and time and effort and relationship building. And I just wish that more people understood that. I think that, the vast majority of journalists are honest brokers who just really see their work as a public service, and that's really just what we're trying to do.
So can I say one more thing, which is I think that a lot of us in journalism are just like being students. And so it's this sort of fun excuse, every day you get to learn about something new. There's some new thing that's happened. You have to learn, you have to read all this stuff, and then you get to call up all of the foremost experts in the world. And if you're lucky, they take your phone call and they explain the thing. Your teachers are often helping me understand really complex policy matters. And then, as Julie said, then there's this task of, okay, I've done all this learning, I've absorbed all this, expertise. How do I take what I've learned and communicate it in a way that is useful to someone who doesn't have that amount of time to learn about it? But I think the motivation that Rachana described of sort of wanting to hold the powerful to account is really important. But I also think that there's this kind of selfish motivation that a lot of us have too, which is just, it's really interesting to learn about new things all the time, and it's an excuse to keep doing that throughout our careers.
Oh yeah, I can't believe people still pay me to do what I do because I have so much fun doing it every day. And so for that reason, I also feel really fortunate. So.
Great. So I have a couple rapid-fire individual questions since your jobs are very different from each other. And so first, Julie, you just started a podcast, which all of you should be subscribing to right now. I did it so you don't have to. What the Health? It's the name. Health, not... what inspired you to do that? Margot's been on the podcast before, and how has the age of social media changed how you do your job?
Well, I actually came to KHN with the intent of starting a podcast. So we launched it last July, sort of right in the thick of everything that was going on. Margot's one of my co-panelists, and Rachana's editor, Joanne, is another one. And one of the conceits is that we are an all-women panel. Just there are so many all-male podcasts, and there are so many incredibly talented women covering healthcare right now, which actually makes me really happy. When I covered healthcare, I covered the Clinton health plan, and after it tanked, most of the big-time political reporters who'd been covering healthcare went on to do other things. And I remember an editor saying, it's time for you to change beats. You need to master something else. And I looked at him and I said, healthcare isn't over. And sure enough, it was only a year or two later when the Republicans swept in and they tried to undo Medicare and Medicaid. And there were basically like 4 of us who had any understanding of what was going on because everybody else had fled to other beats. So I'm sort of cheered right now to see how many health policy reporters there are and how many of them are women. And I think the podcast is important. I actually get a lot of feedback from students. I think we have a lot of student listeners to What the Health, which is great because I think it's just a sort of new way of delivering the same kind of information. And little plug, this week's podcast that will drop tomorrow, we took a deep dive at what happened over the last year and a half to the Affordable Care Act and what it might mean going forward.
Great. So Margot, over at the Upshot, you explain a lot of academic journal articles and very complex topics to the general public. What are some effective ways to do that, and what have you seen done well or maybe not so well in that arena?
Well, I feel like a lot of our political discussion is not very empirical. So people just say things, but they don't have a lot of evidence behind what they say, or they don't know what the evidence is. I think it's not that people are always wrong, but that they have instincts about what the truth is, and they don't have evidence about what the truth is. And I feel like a lot of political and policy reporting is focused on those things that are said, on the rationales and sort of for policy that may be unrooted in truth. And I have been sort of excited to see how much the Academy actually sort of quietly and not always in a way that is clearly communicating with us is actually trying to answer a lot of the questions that politicians are interested in. And so it feels to me like a really interesting and rewarding, but I think also helpful service to try to bridge that divide. So I try to write a lot about research that I think is policy relevant, and I do that in a couple of different ways. One way, sometimes I just see a paper and it blows me away and I want to write a whole article about that paper. I'm just going to explain. And I think my team is really wonderful at data visualization, and so I have great colleagues, and I think we have sort of unique capabilities to sort of explain really complicated, especially economics research, to the public. There's just a lot of expertise in economics and statistics on my team. But the other thing that I like to do is to try to pull together sort of all known knowledge on some really important question. So, if there is something that is happening in the news, I kind of like to take some time and do a literature review and talk with the scholars who really know this issue well and try to provide some context around the debate. Here's what we know about what this policy is likely to achieve. And I hope that when it's successful, it is indeed bridging that divide, allowing the general public to understand what academics do and what knowledge they have derived, and also hopefully is also helping policymakers have a little bit of a better formed debate, a little bit better informed sort of policy-making process.
And you're a fan of metaphors, from what I understand.
Yes, I'm a big fan of metaphors, and I think metaphors are really powerful in helping ordinary people understand complicated things. So, if you can if you can compare something arcane in the healthcare system to something very familiar in their regular lives, I think it's really helpful. One that I'm very happy with, although your Professor David Cutler helped me with this one, is at one time I was trying to write about adverse selection in insurance markets when some of the Affordable Care Act premiums were going up. And I compared it to having a bunch of football players show up at your all-you-can-eat lunch buffet.
So Rachana, you, as mentioned, helped with the reporting that eventually led to Secretary Price resigning. Major question, who's going to play you in the movie? That was actually
I told Emma I did not have a good answer to this, so I will happily seek any suggestions that you all might have on it. But I will say, I think before I think about that, I have to do due diligence and acknowledge my colleague Dan Diamond, who also obviously was a big part of those stories. He was my partner in all of that, and so if there is a movie, we should probably also strategize on who should play who, so that there isn't really awkward rapport between the two actors. You want to make sure they have good chemistry, right? So.
But can you tell us a little bit more about any stories on that, and how it changed the way you think about how journalism plays a role in our public debate?
Well, I'll say, when we first started looking into this, which was, what month are we in? It's April. Okay, so last May, which seems like an eternity ago, that's when it first came to our attention. And I didn't believe it, even myself, honestly, at first. And that, I think, goes to show why you keep digging. It taught us a lot about persistence, I think, and just... It took a long time, and especially in this day and age with the 24-second news cycle, I think is what my boss Joanne will say. It's not even 24 hours anymore. It's really hard to set aside the time to really dig into a project like that when you have a million other things going on. So as far as what it taught me, though, I mean, I think this past year, I think not just for HHS stories, but just across the federal government, it's just been the amount of incredible work that's happened for reporters that are covering Washington, whether it's Russia, whether it's the EPA, whether it's anything. I mean, it just goes to show you why they're necessary, because there are a lot of things happening behind closed doors that no one would know about. And that includes, former Secretary Price's travel habits.
So I'm not going to let you all get away without a Medicaid question. So over the last year, we've seen Medicaid rise in prominence politically, with advocates coming to Capitol Hill and really defending the program more than any. At the same time, we're seeing work requirements and other actions happening at the state level to really restructure the program in various different ways. What do you think the future holds in terms of states continuing to look at the program and restructure it in various ways, as well as the role that advocates will be playing in the future?
So when I first came to Washington, I had been a healthcare reporter in New Hampshire, so I had covered the New Hampshire Medicaid program. And one of my first meetings that I took in Washington, someone said to me, well, one Medicaid program, and there's like 50 million of them. Because it turns out that there's not just 50 states, but there's also D.C. and Puerto Rico, and what are the other ones I'm forgetting? The Virgin Islands, yeah. And I think the Affordable Care Act was really an effort to try to bring some uniformity across that chaos, to say Medicaid is still going to be a program that is managed by states and where there's kind of shared oversight and experimentation, but where we're just going to have some basic standards. All Medicaid programs should cover these populations, they should cover these services, they should have these processes for signing people up and deciding who's eligible. And there was like a little bit of a moment of feeling like that was happening. And now I think what we're sort of seeing is a little bit of a disillusion of that uniformity. But at least to me, it sort of feels like we're going back to the way it was before. So it doesn't feel to me like something completely brand new, but instead, if you know one Medicaid program, you're going to know one Medicaid program. I think there are opportunities to learn from this. I mean, for those of you that study Medicaid, I think having some variation between states could be helpful in trying to figure out how to do Medicaid optimally. But I also think it seems clear that the objectives of some states are to try to cover as many people as possible in their Medicaid programs, and the goals of other states are to try to cover a lot fewer people. And so, to the degree that we care about having access be more universal, I think those disparate impacts may be bad.
I think two big things surprised me last year about Medicaid. One was how popular it turned out to be with the public, and how much the real pushback against capping federal funding of Medicaid turned out to be a big factor in the Republicans' inability to undo the ACA. The other thing is the extent to which some of the changes that the Trump administration is allowing, particularly work requirements, particularly this, the partial expansion where you expand but only up to 100% of poverty instead of 138% of poverty, the extent to which that seems to be swaying some of these very hardline Republican states that said we are never going to expand Medicaid into saying, well, maybe we'll expand Medicaid. So, in this odd way, you could end up with states that might not otherwise have added people to the rolls, adding people to the rolls, albeit with these, changes that a lot of Medicaid advocates certainly don't like. Then, of course, you see the states that haven't expanded that also want to cut back. So there's all kinds of sort of cross-cutting currents right now with Medicaid. It's a really interesting time, I think, to watch the program as a journalist.
I mean, I would say one thing about the staying power, or, that we saw last year that I thought was really interesting, and I can't claim credit for this historical knowledge because I was not covering Medicaid block grants and per capita caps in the 1990s. But one of the things that I think ended up really being true is, in the repeal efforts last year, I mean, really, it was repeal, alongside this huge restructuring of the social safety net in America. And I think the difference between one of the reasons anyway, why it was unsuccessful is because as soon as you make an effort like that, if the discourse around it is about health coverage for people and taking it away from people, that's not going to go over well for anyone who's trying to push it. Whereas in the 1990s, I think it was more about a debate about government, maybe like the safety net's too large, our welfare programs are too big. And
it was mostly about federal versus state in the 90s. It was this is not a federal responsibility. This should be more of a state responsibility, which frankly is what they were doing last year too. It just didn't go over as well because there were way more people involved.
I just think that the idea, that there are still a lot of people who think that, the size in federal government is too big and it's, it's just too invasive in everyone's lives. And so when it's a debate about that versus a debate about whether your neighbor has health insurance, those are going to result in two very different outcomes when it comes to legislation, right? And so I think honestly, that's one of the struggles that people who, for Republicans who say they support repealing the ACA or, paring back Medicaid through these administrative measures, you can't make it about coverage. That's not going to work. I mean, people will be really, really upset, and you'll see advocacy in a way I think that maybe didn't exist in the past. So I think, but our current CMS administrator, Seema Verma, has made changing Medicaid, especially for the ACA population, probably one of the biggest priorities. It's one of her largest goals. And so I think that's going to be definitely, we've already started to see new approaches that the administration is trying to take, with what are the requirements, needed for someone to obtain coverage. And I think, they're going to keep trying to push the envelope on what they think is legal. But I'm not a lawyer, so I'm not going to speculate on whether those things are going to stand up in court or not.
I did a story, I guess a few months ago, sort of looking back at the history of how, from like the English Poor Laws, we've thought about social welfare. So first in England and then in the United States through the development of all these programs and their changes. And one thing that was interesting to me is to think about the long-term trajectory of Medicaid, that it was sort of passed as an afterthought when Medicare became law. Very few people were eligible for it. They tended to be people who were in these special categories. So, if you were blind, if you had certain kinds of disabilities, minorities, if you were elderly and poor. And over time, Medicaid really has changed. I think the character of Medicaid has changed, and the populations that it served has changed. And the Affordable Care Act, intended to expand Medicaid in this kind of universal way across all the states for all poor people, regardless of whether they fit in one of those niches. But that was a little bit less revolutionary than what I just said. It actually was part of a longer trajectory where we saw kind of small expansions over time to cover more children, to cover pregnant mothers, and then states starting to think about it as a universal program for the poor. And I think part of what's happening now is this debate about what Medicaid should be. The kind of norm now is that Medicaid is a relatively universal health insurance safety net program for people who are poor and can't get health insurance through work. But I do think that Seema Verma and other important figures in the Trump administration feel like Medicaid really should go back to being a program that is just for people who are particularly vulnerable, who can't take care of themselves in other ways. And I think some of what's happening in these states is this fight over what the identity of the program will be.
Thanks. So I have...
Is that enough Medicaid for you?
Makes me so happy. So I have many more questions that I have prepared, but I want to turn it over to you, especially considering the time. So if I have one more question that I'm going to ask, but if you have questions and want to start lining up on the mics, that would be great. There's one right here and one right over here. So I do want to acknowledge that we are on a panel of women, and journalism, much like academia and law, where we are sitting, has been a male-dominated industry for quite some time. But in the era of Me Too, I was wondering if you've seen any change in your lives or the world of journalism. I know Julie's talked a little bit about that.
I will give a pitch to the fact that Kaiser Health News is women-led, and we have, I think, a predominantly female staff. I don't think that part's not on purpose. Not like the podcast. The podcast is purposely women panelists, but it just kind of happens that Kaiser Health News is a very female-dominated news organization. Obviously, I've come from a lot of news organizations that were very male-dominated, and it's been kind of nice over these very turbulent months to think, well, that's not happening in my organization.
Yeah, I don't know if I have anything particularly wise to say about this, except I do think that journalism has certain advantages over many other professions because our work product is public. And so I think even though sometimes certainly we've seen examples of women in media who have been disadvantaged by sexual harassment or by discrimination in various ways. I do think that we have a real advantage, and we're lucky that people can sort of see whether we're good at what we do or not, and we don't have to rely as much on the advocacy of bosses and colleagues to advance in our careers. And I think that's why you see journalism is a field in which I think men and women are on relatively equal footing, at least at the level of reporters, because when you're a reporter, like, you publish your words in the newspaper and people can see whether you're good or not. I do think journalism probably still has a little way to go in terms of thinking about management.
Yeah, I would agree with that. I mean, I think management is one thing. Obviously, there's definitely improvement to be made in terms of gender balance and diversity, but at least I can speak for my employer. Like, our healthcare team is equally divided between men and women, and so, which is really great. I think it's I've never felt as though, I'm being unfairly treated because I'm a woman at really anywhere I've worked, to be honest. And for the reasons Margot said also, we're not really, our work is very public, and so people have a way of finding out about you that doesn't rely on necessarily, traditional channels for seeking career opportunities.
I think the bigger challenge for journalism is figuring out how to get people into the pipeline who might not otherwise have thought to be journalists or might not know how to get their foot in the door. Like, I think all of us are far enough in our careers that we have enough articles under our names that people can kind of evaluate whether we're good or bad. But I do think that the profession is not as diverse as it could be or as it should be. And I think I think the big challenge is trying to figure out how to kind of recruit and identify people early in their careers and give them opportunities so that they can reach a point of expertise where they can prove themselves.
And I think the biggest problem in journalism is not gender. and it's not even necessarily, ethnicity, but socioeconomic status tends to be, it doesn't pay particularly well, so really talented people from lower socioeconomic, status would rather become a doctor or a lawyer or go to business school or, do things where they can actually earn a lot of money rather than become a journalist. But there's a real dearth of sort of working class. It didn't used to be. I mean, local newspapers used to be full of working class people because that's pretty much what you could afford if you were working at a local newspaper. I mean, you were working class, that's what you were getting paid. But I think there's less and less of that. It now is sort of an upper middle class kind of profession, and there's a big lack of diversity there.
All right, I don't know who got to the mics first, but we'll start over on this side.
Sure. My question was, how do you balance that you're writing for people who kind of are following this and reading you regularly, as opposed to people who are just coming to your articles for the first time?
I think it's the constant challenge, and one thing that's helpful is my editors, and this has been true for several jobs now, are not healthcare experts. And so everything before it's published is read by someone who has no idea what I'm talking about, and that is a great check. But I don't know. I mean, this is like the most important thing that we do, right? Like if I'm just writing for people who already know everything that I know, like I'm not doing my job. My job is to try to inform the public who's not an expert, who have busy lives, and who are experts in other things. I don't know. I just keep trying, and I read my email. And I talk to people who have read my articles and try to see what their feedback is. But, being a clear communicator is a really, really important part of our job, and it's something that we can always get better at.
Yeah, I think actually, so at Politico, especially for me and policy reporters, this is something we deal with, maybe not every day, but quite frequently, because we have our subscription side, which is Politico Pro, and that's for people who, follow what we do very regularly. And then if we are fortunate, which, I should say fortunate from a public exposure perspective, which is what reporters love, the healthcare team has lots of opportunities, fortunately, to get over onto Politico.com, which is, of course, the more prime real estate, but big political stories that you obviously have to make relatable to a much wider audience. So we kind of have a similar, when, I won't get into political bureaucracy because that's really boring for you guys, but the editing process for us changes pretty substantially, and we also have people who read our copy who have, obviously not as extensive healthcare knowledge as my direct line of editors who who oversee most of the things that I write. So, but it's definitely a challenge. I mean, you have to make things popping away in the first 3 sentences usually so that people keep going, because they won't even, before, I guess it was when you had newspapers, it was, what percentage of readers drop when you go beyond the fold, or the fold or the page, you have to turn it and you lose a bunch of readers. But nowadays it's, literally it's the headline and you see a huge percentage drop off after that, and then, the percentage of readers who get through the first 4 paragraphs, I mean, it's shockingly low. So it's always good to keep that in mind also with how you want to communicate your stories.
So I have sort of an added challenge, which is that Kaiser Health News' model, I mean, everything that we write goes up on our site, but we partner. I mean, that's what we are. We're a news service. So we do stories, we do radio stories, we do TV stories for the news hour, we do videos, we do infographics, we do a lot of writing for the Washington Post and USA Today and the New York Times, and obviously every single one of those outlets wants a different level of detail, different sort of, who their target audience is. So, I mean, one of the nice things is you can say, okay, I'm going to occasionally the outlet will come to us and say, do you want to write a story on? So you know who you're writing for. Usually, though, you're just writing a story and trying to figure out who the best partner is going to be. So basically, I think as, both Margot and Rashina say, your goal is to make it understandable for anybody, but to keep it interesting enough for the nerds.
So you said that you guys didn't want to get into the prediction game anymore, but inherently with a lot of analysis, there's a degree of uncertainty. So my question is, in an era where anytime someone said something and then it didn't happen, or didn't happen exactly the way I explained it, and it's getting claimed as fake news, how do you convey uncertainty with any of your legal or economic or statistical or any of that kind of analysis?
Every story has its qualifying paragraph, sometimes multiple qualifying paragraphs. Well, this is what we think, but we don't really know. Or experts say more research is required. I mean, there's, it is, a lot of it is how you write it, how you couch it. You want, and it's a constant tension, particularly with editors who want things to be as dramatic as possible. And you always, constantly go back after. It's like, no, you can't quite say this way because we don't know much. Remember, you, the reporter, know more than the editor. So the editor's trying to push you to go as far as you can, but you need to be careful not to go too far, or you will get in trouble by basically overstating what is. So it is, I would say, the constant tension in journalism.
Things being in flux is a great way to say that. That's how many times can we, and especially, I guess, from a political journalism perspective, especially, I think I can say this on behalf of my colleagues who cover the White House. I mean, literally things change. Probably 30 seconds is generous. So, you always have to have those caveats in mind, I think, which is that this is true right now. It may not be true 5 minutes from now. Obviously we want to be able to write as definitively as we can, but there's inherent uncertainty in everything.
So I work for someone, my boss, Amanda Cox. This is like one of her central obsessions is how does journalism convey uncertainty? And I think it's actually much, much harder than any of us acknowledge. I think people are bad at understanding uncertainty or measuring uncertainty. So we have lots of ways that we do it, and not all of them have been successful. So I'm sorry that many of you saw the needle on election night. So there was this jittery needle that was moving around. And the goal of that, the jittering, was supposed to tell you this is not a precise estimate. This is somewhere in this vicinity. We think that there's some uncertainty around this number. And people's hated it. I mean, it was like causing seizures. So, which is just like another way of saying it's really hard. There's really interesting kind of social sciences research when you use words in your story. You say likely, probably, maybe, unlikely. People assign wide ranges of different probabilities to those words. And so I don't actually have a great answer for this, but I think it is an important question. It's an important challenge for all of us, and we have to be careful because I think that some of the language that we've kind of fallen back on historically to try to convey uncertainty actually doesn't really work. So, and in some of the precise numbers that we try to use to convey uncertainty actually doesn't work either. So if you tell readers that, according to the best available evidence at this time, Hillary Clinton has an 80% chance of winning the presidential election, people actually don't think about the fact that there's a 20% chance that she won't win the presidential election. And that's saying 80% is really, really precise, but I think it freaks people out because people just kind of round up. We all have to keep getting better at it. And we think about, on the Upshot, we think about a lot how to convey uncertainty using visualization. And there's a lot of really creative kind of graphical stuff that we do to try to deal with uncertainty. But we got to keep cracking on it, yeah.
So because you all stood this long to ask your question, and we only have a few minutes left, we're going to do a little rapid fire. So you'll ask your question, and then we'll get that last question, and then we'll all answer them together as a group as quickly as possible. So rapid fire, ready?
So you all talked a lot about your position as explaining policy to the public. I was just wondering your thoughts on kind of the opposite, explaining sort of public positions or public opinions to policymakers. Do you see yourselves as having a role in that, or do you see journalists as maybe starting to take a role in that where they may not have before?
Okay, so public opinion, and then...
Somewhat related to that, I think you all mentioned some of your surprise this year in both public interest in health policy and the takedown of the ACA and the strength of signups and open enrollment this year. And I think one big piece of uncertainty that we're all trying to predict the potential impact of is the repeal of the individual mandate. And so not just as journalists thinking about public opinion on some of these policy issues, where and how do you think it's most important or best to weave in actual individual stories in some of these ongoing issues? So not just opinion, but individual stories.
All right, individual stories. And lastly?
Hi, my name's Tinker Reddy. I've been covering healthcare for a long time. I remember when you used to be able to call NIH or Harvard and talk to a scientist directly. I now teach journalism, and we get the written statement. Everyone wants to give a written statement. And so, not just my students, but professional journalists. And so I'm wondering if you have any advice on how to develop sources and find people who will give you not prepared statements.
Great. So, prepared statements. So the three, to remind us all, were explaining public opinion, weaving into individual stories, and then prepared statements. I don't know if you can answer that all in one answer, but as much as you can address one of those, that'd be great.
I'm going to take the first one about the extent to which our job is telling policymakers about what the public thinks. That is. Policymakers are part of the audience that we're serving. I mean, we don't do stuff specifically for policymakers, but yes, an enormous part of our job is to go out and find out what the public thinks and tell the rest of the public what the public thinks. To the extent that policymakers are part of that audience, so much better.
I'll take the second one. I think human stories are a really powerful tool of journalism. I think, I was talking about metaphors are a way of making people relate to complex ideas and policy. I think human stories are another really important way. If you can have empathy for someone who is experiencing a thing that is related to, a policy, it makes it feel more real to you. And so I think that the kind of, it's a very traditional tool of journalists to tell narrative stories about actual people who are affected by policies. I think the challenge is to not use anecdotes to totally guide your analysis. So I think a bad version of telling individual stories is talking to three people and writing a story about what their experiences are and trying to extrapolate broadly about what it means about how the system works. So I think the best stories that use human stories have a lot of background research that kind of undergirds them. That's about, okay, like here is what we know about what the truth is, and here is a person that can help, whose particular circumstances are particular, but whose story can help illustrate this larger trend that we think is important. Yeah, person as metaphor, yeah.
Okay, so I guess the last one is for me. So I would say, two sides of this is that one, technology often provides a wonderful opportunity for you to reach out to people and for people to get in touch with you in ways that did not exist before, even though it is hard to get beyond written statements and emails and people not picking up your phone calls nowadays. But, Twitter, Facebook, all of those things can be really effective, I think, source building techniques for reporters. The other thing is, on the other side of that, even though we have a lot of electronic ways of communicating with people, I think the most effective way to build relationships is actually getting away from that and meeting people in person, having coffee with them, having lunch with them, whatever it is. More face-to-face interaction often is, I've found, the most effective way at getting people to trust you. And trust is really foundational to people talking to you when they're not supposed to be.
I think also, it's easier for me to say this at the New York Times than I think it is for people who are working for smaller outlets. But I think sometimes you just have to put your foot down and say, like, if you're just going to give me this garbage statement, you're not going to appear in my article. And I think if you do that a couple of times, and then but you keep coming back to them and say, I want your voice, I want to understand your perspective, and I think that it's valuable for my story, and they keep giving you a garbage statement, I do think that sometimes that sinks in. They realize that they can't dictate the terms of the interview, but if they don't see you as being really important, or if it's a voice that you absolutely feel you have to have in order to be fair, then that can be a strategy that is not as effective.
Great. Well, we are at time, so I just want to say thank you to the panelists. Please follow everybody on Twitter, and then subscribe to What the Health. You'll get more conversations like this. And also thank you to Chilpi and all of the sponsors that help make this day possible. Thank you so much.